Hello friends, I am Dr. Pratibha Singh, DNB Pediatric Second Year Resident. I'll be starting with DNB PYQs series. So before I start, I would like to tell you about the exam pattern of DNB. 4 papers are there, paper 1, paper 2, paper 3 and paper 4. Each paper is of 100 marks. So total theory exam is of 400 marks. To pass, you have to secure minimum 200. We all know 50% is the passing rate. Now, each paper is of 100 marks and each paper have 10 questions. And each question have A part and B part. So, 10 questions of 10 marks, total 100 marks, one paper. 100 marks, 4 papers, total 400 marks. And each question can be divided into 5 marks and 5 marks like this. So I hope I am clear with it कि एग्जाम पैटर्न कैसा होता है. 100 मार्क्स का पेपर होगा, 10 क्वेश्चंस होंगे, हर एक क्वेश्चन 10 मार्क्स का होगा. पूरा 10 मार्क्स का ना होते हुए उसमें पार्ट्स होंगे, पार्ट ए एंड पार्ट बी. पार्ट ए ऑफ 5 मार्क्स, पार्ट बी ऑफ 5 मार्क्स, इस टाइप से. नाउ स्टार्टिंग विद द फर्स्ट, we are starting with DNB October 2024 sessions. First questions which is there is enumerate the various duct dependent congenital heart disease that can present as neonatal emergency, and it was asked for 5 marks. So what they are talking about is duct dependent lesion. Which duct they are talking about? They are talking about patent ductus arteriosus. We know that during intrauterine life, we have a duct between pulmonary artery and aorta. This communication between them is called as ductus arteriosus. During fetal circulation, this duct is important because the lungs are not functional and whatever blood which is pumped from right ventricle, it gets shunted to descending aorta and there is further supply of blood to the whole body. So this duct has importance in intrauterine life. But as soon as the baby is born, these ducts are closed because that is a normal physiology. So physiological closure of these ducts occur at 10 to 15 hours after birth. And anatomical closure, they occur at 10 to 21 days. Why this closure occurs? This is a whole different topic about fetal circulation. But as after birth lungs are functional, closure of this duct is important, and if this duct persists in a normal child, then there are certain complications to it. But there are certain conditions in which this opening of duct is desirable. So the examiner is asking about in which condition this patency of duct is important. So it is obvious that this duct patency is important in two scenarios. Like this is right ventricle, left ventricle. Pulmonary arteries taking blood to the lungs and aorta is taking blood to body. So whenever there is any kind of obstruction to the flow of right ventricle, at that time to maintain the circulation to the lungs, this patency of duct have importance. कि lungs में blood नहीं जा पा रहा, to restore that oxygenation, to restore the blood flow to the pulmonary vasculature, patency of this duct is important in these cases when there is right ventricle outflow obstruction, there is decreased pulmonary blood flow. Similarly, when there is any kind of obstruction to the left ventricle outflow, like there is compromise with the systemic blood flow, then also maintaining the patency of this duct comes into play. So since the examiner has asked about the lesions, different duct dependent lesions, and it is a 5 marks question asked only for enumeration, so we will only be enumerating with few lines about like PDA, physiological closure at 10 to 15 hours after birth, anatomical closure occur at 10 to 21 days after birth. In DNB we have to be very precise because they are not going to give extra marks to us no matter we write 10 pages or 20 pages. However description we can write, but examiner will end up giving 3 marks, maximum 4 marks. 5 marks are like out of imagination. Okay, any examiner will give 5 out of 5. So we have to be very precise in DNB theory paper. So let's begin with the answer. There are two situations when the patency of these ducts is required. There is duct dependent pulmonary circulation, or there is duct dependent systemic circulation. Let me get this alignment right. Condition where duct is important to maintain the pulmonary circulation because there is obstruction to the flow of right ventricle. What are these conditions? This is critical pulmonary stenosis. It is Toff tetralogy of Fallot with pulmonary atresia. Another condition is pulmonary atresia with intact interventricular septum, and there can be severe Epstein's anomaly, and there can be tricuspid atresia with pulmonary obstruction. So duct dependent pulmonary circulation is required when there is severe pulmonary stenosis, compromise to the pulmonary blood flow, Toff with pulmonary atresia with intact interventricular septum, severe Epstein's anomalies, and tricuspid atresia with pulmonary obstructions. These are the terms which we all have came across during our MBBS or residency days. So whenever there are details like what is Toff or what is Epstein's anomaly, we will cover it in subsequent sessions. What are the characteristics and what are the features found in it. For a time being, we will just enumerate because the examiner has asked us to enumerate the conditions. Then duct dependent systemic circulation. When there is systemic circulation compromise, then these ducts are important because to restore the circulation, we want to restore the circulation of whole body. What are these conditions where systemic circulation is affected? When there is obstruction to the left ventricle outflow. What are these conditions? First is hypoplastic left heart syndrome, critical aortic stenosis, interrupted aortic arch, and critical coarctation of aorta. These are two conditions. These are two important conditions where patency of duct is required so that there is no hypoxia and cyanosis, and for survival this is important. Then there is another condition where mixed circulation is there. To maintain the mixed circulation, we require patency of PDA. What are these conditions? It is TGA with interatrial or interventricular septum. Second is TAPVC. I hope you know the full form. Total anomalous pulmonary venous connection with obstruction. In such condition, there is a requirement of mixing of oxygenated as well as deoxygenated blood. And for mixing, we require PDA patency. These are the conditions where PDA patency is required. Then a common next step is how do we maintain the PDA patency, because physiological closure is occurring within 10 to 15 hours. To maintain the patency, temporarily, because the final treatment, definitive treatment is surgery. Till between diagnosis and surgery, there is a time period where we don't want our child to end up in hypoxia and shock like condition. So we will maintain this patency temporarily with pharmacological measures. The drug of choice is PGE1, which PGE1 infusion is required in a dose of 0.05 to 0.1 microgram per kg per minute. Prostaglandin E1 infusion is required to maintain the patency of drug. Definitive treatment, we all know it is surgery. So yes, we covered our first question, which was about enumerating the various duct dependent lesions that can present as neonatal emergencies. Okay, the next session we will be covering our next questions. And if you think that there in 5 marks question there can be further more details can be added to it, then please comment down in comment sections so I can improve and I can share with you all how to proceed with this question next time.